सेंटर पे है।
Hmm. Going very slow. Hi, I am Dr. Rohit Modi. Uh, Thanks to Aditya Birla Capital Health Insurance for giving me the opportunity to connect to so many. Today, I'm going to speak about the common health issues which we face, especially during the COVID times. So, well, one of the most common things which we face in our practical day-to-day life is that we see that professionals, any one of them, who's a computer engineer, a doctor, or a lawyer, or an accountant, they spend around 7 to 8 hours or more on the computer screen. And this has led to us to form a fancy term which is known as computer vision syndrome, which is also referred to as digital eye strain. And most of these patients, when they come to me, they present with eye strain. That is, they have a non-specific headache. They have, kind of a blurriness of vision, slight heaviness in the heads. They have, gritty sensation or something which is, pricking in their eyes. Many a times, these patients have neck and shoulder pain. Most of these do well with a simple 20-20-20 rule. That is, taking a 20-second break and looking 20 feet away every 20 minutes while they are working. I'll repeat that. It's a simple 20-20-20 rule. Taking a 20-second break to view something 20 feet away every 20 minutes. And well, this is a basic thing which can be done, but there are certain aspects one should consider while watching a screen, especially when it is going to be done for a longer time. That is how the screen is lit up. That is, if there's poor lighting, if there is excessive glare on the screen, if the viewing distance is too large or too near. We many times see a lot of people watching the cell phone by keeping it very close to the eyes, and if the sitting posture is not proper or there are some uncorrected vision problems. The most commonly of that is if the patient has an eye power, the patient is either wearing a wrong power glasses or is not wearing glasses at all. So in these circumstances, we have to take care of the basically the eye power also, and there can be certain vision therapy which can be considered. Also, while viewing the computer, we should look at a couple of things. Like I said, a proper distance is very important. Keeping the screen at 2.5 feet distance is the right way to go forward. And if there are any reference materials, such as you're keeping any paper or document, it can be keep at a distance so that you don't have to keep your head moving constantly. The lighting should be appropriate to avoid glare, and anti-glare screens should be used. Now, sitting position is going to be very important. And while sitting, one has to take care that his neck and back and the arms are adequately supported so that there is no unnecessary neck or lower back pain. Because a lot of professionals, 10 years, 15 years after working, they get severe lower back pain, especially late in the evening, and that restricts their working capacity. And like I said before, 20-20-20 rule, that is taking rest breaks after every 20 to 30 minutes can go a long way in improving your eyes, as well as it gives rest to your neck and the back. Probably stretching and moving the neck, having a glass of water during the break will also help you. Another important thing, have you seen the kids watching mobile phones when they have issues? And they have uh, a staring look in front of the eyes, and that staring look is something what we adults also do when we see a screen, and that's the time we forget to blink. Now, blinking is very important. Blinking minimizes the chances of you developing a dry eye. And what are the dry eye symptoms? A patient gets that grittiness, something is there inside the eye. Some of the patients do complain that we feel itchiness in the eyes, and this is because of dry eyes. A normal individual is supposed to blink 15 to 20 times, and that's what we recommend. That blinking is very important when you're using your screen. Apart from this, you can have over the counter lubricating eye drops which are available, which can be used 3 to 4 times. And if the symptoms persist, it's always good to visit your local ophthalmologist. Now, another thing which is actually exploded is that in today's kids, an entire generation is growing up with smartphones, tablets, and other internet-enabled electronic devices, and this has got all parents, including me, worried because of the too much screen time. And most of the parents come and tell me that my kid doesn't eat without the television or the mobile being on, or if I have to do something, let's say I have to give a nebulization to my kid, or make him have the medication or anything, I have to encourage this kid by giving him the screen time. And too much screen time can have effects such as obesity, sleep issues, uh, behavior problems, and like about the sleep issues, it's if the kids watch too much television just before the bed, they tend to sleep later, they can have insomnia. In fact, for adults also, we recommend that you should not use mobiles on the bed while sleeping. So it's better that these screens are kept away from the bedrooms. Behavioral issues can be such as emotional, social, and attention problems, which have been noticed in these kids. And well, these kids also can have educational problems, and exposure to too much violence can also lead to child and adolescence and psychiatric problems. Now, basically, these things can also harm your relationship with the child. So it's better that we establish certain family rules with electronics, especially during the lockdown time, because there's going to be excess of video games, videos being seen on the mobile to keep your kids, busy at home. And the few household rules can be there can be no digital devices during family meals, no screen time in the car, no screens should be allowed in the bedroom. You can basically have family fun times where you can devise certain games or you can play with the kids so that your screen time and the kids' screen time reduce. Or you can encourage reading in the kids. That is going to go a long way for the eye care and overall development of the kid. The American Academy of Pediatrics had to come up with a media guidelines, and they recommend that the kids below 1.5 years of age should not have any screen time. And what I have noticed in my practice is most of the kids develop the addiction to mobiles at a pretty early age. In fact, I've seen kids, they cannot sit idle in the waiting room or in my consulting room without the mobile being on. And when they come with the grandparents or parents, they have to be given the mobile to keep them on so that I can examine their relatives. So, like I said, kids below 1.5 years of age shouldn't have any screen time, while for 1.5 to 2 years of age, the parents should only choose high quality media and watch it for less than 30 minutes a day. That's it. And for the kids between 2 to 5 years old, it would be less than per hour. And above 5 years, the kids can watch probably 2 hours of day. But most of the times, it should be supervised. I see my 2.5-year-old kid, she handling the YouTube on her own and changing the videos herself. So it's very important that the kids are getting supervised when they are being, exposed to any kind of internet-based device. Another common thing which parents keep on asking me, what food is good for the eyes? And like everybody's favorites, carrot is obviously good. Kale, spinach, they have good content of vitamin A. And there is another antioxidant which is known as lutein. For the non-vegetarians, cod liver oil is good. And if the butter is fortified with vitamin A, that's also a good source. And sweet potatoes, basically, green leafy vegetables, colored fruits and vegetables are good source of vitamins which are really important for the eyes. Now coming on to the next section, apart from the things which we faced during the COVID time, that is the excessive screen time, there are certain myths which I would like to burst. Now, the first myth which I'm covering today is for cataract. Now, an ophthalmologist is obviously associated with cataract, and a lot of patients of mine come and tell, we are waiting for the cataract to get right. वो पका हुआ होना चाहिए तभी हम कर पाएंगे. Well, that is something 3 decades old concept. At today's era, with the laser cataract surgery, you do not wait till cataract happens. In fact, it is harmful for your eyes. You should get it removed as soon as you find any difficulty in doing your daily routine activity. And that is going to be your decision. Whenever ophthalmologist says that you have a cataract, you choose when you get to operate. But if you get it operated at the right stage, it is going to be better. Another thing, one of my areas of interest is diabetic eye disease. And a lot of patients I meet, in fact, my own relatives, they say we have diabetes, but Rohit, we do not have any eye problem. So why should I get an eye checkup done? Why we are behind us to get an eye checkup done? You know, most of the patients with diabetic eye disease do not have any symptoms in the early stages. And as we know, for all diseases, treated early, the treatment is simpler, shorter, and most effective. If treated late, it gets more complicated, it's expensive, and it can still result in some amount of vision loss. So it's always better if you're a diabetic to get your eye tested regularly, probably once in 6 months to a year. And if you have diabetic eye disease, then you have to probably follow 3 monthly. Certain guidelines which have been recommended by the National Institute of Health of United States are that you take your prescribed diabetic medications regularly during the lockdown. Be very careful, don't neglect that. Maintain a healthy weight, because during the lockdown the physical activity may reduce, you may tend to gain weight. So make sure that you maintain a healthy weight. Probably you can add more physical activity to your daily routine at home. If you have a treadmill, or you can do home based exercises, there are a lot of fitness experts who are ready to help you online. Also, you should regularly monitor your glycosylated hemoglobin. This is very important. This gives you an average sugar level over a period of 3 to 4 months. This average is better than taking random test because it tells you your actual control. Again, one of the things which can worsen the eye issues is your blood pressure and cholesterol levels. That should be kept under check. And if you're smoking, kick the smoking habit, because smoking is not only injurious with respect to lungs, because we commonly associate smoking with lung cancer and heart disease, but smoking can also cause major vision loss. So that's very important to be healthy, keep the smoking habit. Now, another common things which my the parents asked me is that, will eye exercises help to reduce the eye power? So the answer is no. There is a kind of a vision therapy which is incorrectly referred as IDs exercises, may help to conditions which are other than eye power, but eye exercises wouldn't help you to reduce the eye power. Wearing glasses will definitely give your kid a clear vision but won't help in reducing the power. So you should wear glasses of correct power, and you should get them checked regularly, but to maintain good vision. For kids, it improves their education, and also it helps them in sporting activities, but it won't help them reduce their power. Also, a lot of times parents of infants and toddlers come and tell that, my kid cannot read letters or talk. So how can you examine his eyes? How can we know that the kid has power or not? So we doctors have, devices which can be used to test powers, even if the kid is as early, old as 6 months to a year's age. So the first checkup should be done before 1 year of age for your kid. That's the best way to go forward. Another thing which is a leading cause of blindness, and the awareness for this is very less, is glaucoma. Glaucoma sometimes is related as high pressure inside the eye. Now, this is called as jhamar in Gujarati, or kaj bindu in Marathi, or kala pani in Hindi. So, patients, who have glaucoma should encourage their family members to get tested, and glaucoma will not eventually lead in complete blindness. We should understand that. Glaucoma is a disease, if treated adequately, and we have got fantastic treatment modalities for that, can, the blindness can be prevented. Now, another thing, we keep on saying to the patients who have conjunctivitis, you should wear dark goggles, because, we feel that looking at into the infected person's eyes, we can get sore eyes. Although conjunctivitis is highly contagious, we do not get it, by looking into the eyes of an affected patient. In fact, it is acquired when the handkerchiefs or towels are shared, or the person's, the eye liquid basically comes in contact with you. Now, another thing which my patients keep on asking me is whether eyeglasses are really helpful. Yes, they are. They prevent excess glare and UV rays, and this UV light is not good for the eyes, and it can cause a lot of trouble, and it can cause something disease known as cataract, or it can cause early degenerative changes in the retina and other issues. So it's a good idea to wear good quality glasses. So, well, I have done with a lot of things which I've discussed today. I would be happy to, answer the questions. So I have got some questions in the comment section. I would first cover them. I have a lady who's asking that, my kids is watching a lot of iPad and TV, and its eye starts watering also. So what should I do? So, well, if your kid has a lot of watering, and the kid is squeezing the eyes like this, or rubbing the eyes a lot, the kid may have glasses. So you should get the eye power tested as soon as possible, probably after the lockdown is over. And restrict the screen time, as I have told. I've already stated the guidelines according to the age, to what extent you can allow your child to watch the screen. Now, the blue filter on the phones are kind of protective. It has a soothing effect, especially during the night time. So you can use blue filter on the phones. Another person who has asked me is that she's working from home on laptop 8 hours continuously, and then obviously, in the spare time watching online streaming videos such as on Netflix and Hotstar. So, will the eyes get affected? Now, excess of screen time in adults per se don't affect the eyes directly, though you can get eye strain and then headache and other issues. But I would suggest that you can probably take, break every 30 minutes to 60 minutes, close your eyes, stretch yourself, look at a distance, and maybe continue working. Also, but along with that, to keep your body healthy, it's always good to have physical activity done during the daytime. Now, another person has asked me a similar question, that he says, can my kid watch videos, and can his eyes get damaged uh, if he's watching videos? So, well, if you maintain a certain distance and watch it for a limited amount of time, the kids' eyes don't get damaged. The problem in kids is that as that screen time increases, the physical activity time reduces. And once the physical activity is reducing, their sun exposure is also getting reduced. One of the recommendations which was found in formulated in Singapore was that they actually encourage the school kids to get exposed to sun for more than an hour daily during the school time to reduce the incidence of myopia or short sightedness. So you should try to restrict the screen time in your kids as far as possible. Encourage them to play outdoors. Obviously, staring at sun directly is not at all recommended. It is in fact harmful. What I'm suggesting is that the kids should play in sunlight so that it is good for physical activity, and also exposure to sunlight of skin helps the body to generate vitamin D. Now, there's Mr. Patel who has asked me that he's 54-year-old and he feels eye dryness during working on the laptop. So, should he go to a doctor? Now, well, Mr. Patel, I would like to also ask what kind of symptoms you have. Now, if you have dryness and that grittiness, or you have itchiness in the eyes, if it is mild, you can probably use a lubricating eye drop which is available over the counter. Though I do not support or have association with a pharmaceutical company, any company which is making a drop which is known as carboxymethyl cellulose can be helpful. It is over the counter product. But if your symptoms do not get relieved, I would recommend that you visit a local ophthalmologist. Also get your eye power tested. Above the age of 50, it is also a good idea that you get evaluated for glaucoma, and if you're a diabetic, you should get evaluated for diabetic eye disease also. Couple of things I would like to add in this discussion is that uh, one of the major things which I see is that as the screen time is reduced, we are doing less of physical activities, and this physical activity is going to be very important with respect to the kids' physical and mental development also. So we should also encourage the kids to play outdoors. uh, Mr. Patel has, gotten back as he has said that he feels dryness when working on the laptop. He's using a liquid, but he didn't feel any difference. Mr. Patel, in that case, I would highly recommend that you visit your local ophthalmologist so that if there's any other issue, that can get sorted out. One of the things I would really request the viewers today, that whoever is 40 years above in your family, please encourage them to get evaluated once at least in a few years for glaucoma. And it's very easy to treat glaucoma if it is detected at an early stage. And if you have known any diabetic in the family or any patient with high blood pressure, please encourage them to get their retina tested so that the diabetic eye disease or high blood pressure eye disease can be checked and treated at an early stage. Basically, eyes are a reflection of a general body health. So, a healthy eyes, if you want, you need a healthy body. So, whatever, if you maintain your body, your eyes are also automatically going to get maintained in a nice way. They are a part of the body, they are not apart from the body. Now, I have a question from a mother. Her 3-year-old daughter squints a lot in natural light, and she's asking me, is it common? Now, well, obviously, if there is deviation of the eye which is noted, you should visit an ophthalmologist. And if your daughter is 3 months old, I would really recommend that if you can meet a pediatric ophthalmologist. Now, ophthalmology is also not a single branch. There are multiple specialists in a single specialty, like you have a cardiologist, a liver specialist. In the eyes, also, we have someone who just looks at the kids' eyes. So I would recommend that you meet a pediatric ophthalmologist for your daughter. Another lady has asked that her mother has glaucoma in one eye and cataract in the other eye, but she is not getting operated. Now, ma'am, most of the glaucoma patients do well with the eye drops. I wouldn't comment particularly for your mother's case, but if she's comfortable with eye drops, surgery may not be required. But if she's progressing in spite of the best medication, surgery would be a sight saving procedure. Another thing is that uh, you know the cataract, if get operated at the right time, can give you the best results, because cataract surgery, when the cataract ripens, doing a laser surgery becomes very difficult and the chances of complications are more. So you should convince your mother to get operated at an early stage. Another person has asked me that since we have got a lot of options, spending most of the time on laptop and mobile because of the there are a lot of uh, websites which help us stream so many movies, shows, and we can connect with our friends. And during especially the lockdown period, when we are not able to go out, he's asking me any exercise would help him, and what are the symptoms of defective eyes. First, like I said, eye is a part of the body. If you do a physical exercise, you're maintaining your body weight, you're eating healthy, that's more than enough. And you should take short breaks after every 30 minutes to 60 minutes of screen time, and that would be more than enough. And if you have basically decrease in vision or uh, blurring of vision or non-specific headaches, means that you're having excess of screen time. Mr. Jaspreet Singh, I'm sorry, sir, I didn't get your question. You have asked me, is we able to increase as eyesight of it is decreased by zero point 0.5 or zero point 0.25? I believe that you may be having a very low power glasses. Having glasses is not equivalent to having defective eyes. So for all those who think that people who are wearing glasses have defective eyes, no, I'm sorry, they don't have defective eyes. Look at me, I'm wearing glasses. I have a very small power, but it doesn't mean that you have defective eyes. Some people are thin, some people are slightly obese, some people are tall, some people are short, some people have glasses, some don't. So one of the the viewers have requested me to speak in Hindi. एंड सुमित सिंह जी, आप हिंदी में मुझे पूछ सकते हैं। आप अगर हिंदी में लिखेंगे तो मैं हिंदी में भी बोलना चाहूँगा। मेरी भी मातृभाषा हिंदी ही है, तो आपको कुछ भी पूछना है तो आप हिंदी में पूछ सकते हैं मुझसे। Mr. Mohammed wants to know that which eye exercises will be recommended to relax if I am on screen most of the times. Sir, again, like I said, eye exercises are not necessary. Your physical exercises are good enough. The only thing is you can take short breaks, follow the simple 20 seconds break after every 20 minutes, looking at 20 feet distance away from the screen. That should be good. Probably while working, you can just close your eyes, rub your palms, keep it on the eyes. It will help you relax. Maybe move your neck, stretch a bit. That should be more than enough. Again, I'm reiterating the fact that during the lockdown, keep a healthy diet. Aditya Bidla is having daily online fitness programs, nutrition advice is being given. You can follow that. If you keep your body healthy, your eyes are going to be healthy. uh, Somebody has asked me a solution for external hodulum. Sir, well, I would suggest that you should visit your local ophthalmologist. He would be able to guide you after examining, because there can be quite a few presentations which can mimic external hodulum. So it is better that your local ophthalmologist sees and examines and then gives you a treatment. Well, Miss Deepa has asked me how much time we should work out for free diabetes patient. Is walking good enough or exercise? Well, ma'am, I'm not a diabetic specialist. I'm a diabetic eye disease specialist. But I would suggest that if you follow proper nutritional guidance and maintain a healthy weight, that should be good. But you can speak to your physician for more details. Somebody is asking what are the symptoms of coronavirus. Well, for the eyes, conjunctivitis or red eye can be the initial symptoms. So, well, for us, if the patients have a travel history or a history of exposure to a coronavirus, infected patient, then we would like the patient to get screened and tested for that. The systemic symptoms of corona would be explained much better by a physician. I'm sorry, and I'm an ophthalmologist. I'm not a physician. Mr. Sandeep Bhatt has asked me that he has a bacterial infection and he's using a couple of eye drops, but it is not improving. Sir, I would really recommend the kind of drops you're using. I do not want to name them on the online platform because that would not be appropriate, but I would highly recommend that you visit your local ophthalmologist and do not take over the counter treatment for this bacterial infection. Mr. Nirmal Singh has asked me a valid question that how can he know that he's free from glaucoma at the age of 60? Sir, you should visit your ophthalmologist every 1 to 2 years. While examining the routine checkup, we all do examine the eye pressure and other things which can give us an idea whether you have glaucoma or not. Glaucoma, for a good part, for majority of the patients, do not have any symptoms. Most of the patients get symptom at a much later stage in the disease. That's why it is known as silent thief of vision. So I will highly recommend, if you have not get an eye checkup done in the recent few years, please visit an ophthalmologist after the lockdown is over. Now, Mrs. Rachna Siddhar has asked me that she has undergone both eyes cataract surgery. One of the eyes was operated 3 years back, causing inconvenience, and she is not able to feel blur. She's asking me any recommendation for the eye drop. Ma'am, on this online portal, we are not prescribing any medications, so I'm sorry for that. But I would recommend that you may have a eye power change, or there can be other issue. So if there is a sudden drop in vision, or if you have redness or pain, you can visit an emergency. Or if there is a slight decrease in vision, a slight inconvenience, I would request that let the lockdown get over and then meet your ophthalmologist. Yeah. So Mr. Unmesh had asked me if I can discuss more details about glaucoma. Certainly, sir, I would love to do that. Uh, Glaucoma, as I have discussed, is known as silent thief of vision. Glaucoma can cause, uh, you know, decrease in vision, which can be gradual and which appears at a later stage of the disease. So that's why we recommend that the patient get tested, especially who are above the age of 35 or 40. Now, as your age increases, the chances of you having glaucoma increases, especially people who have a family history of glaucoma. And that's why for the people who have family history of glaucoma, we tend to check them up early and repeatedly so that we can pick up the disease early. There are many treatment modalities available for glaucoma in terms of eye drops, laser therapy, or a surgery, and that is done at a stepwise manner by an ophthalmologist. So, your local ophthalmologist would be the best person to evaluate you in case you have a family history of glaucoma. And most of the routine eye checkup by an ophthalmologist does include a glaucoma checkup also. So one of the viewers have asked me that she does regular eye exercises and she wearing so eye exercises. Let me tell you, are not harmful at all. But we should not have unrealistic expectations from eye yoga or eye exercises saying that the eye power will decrease. Eye power wouldn't decrease with eye exercises or wearing glasses. Basically, there is certain visual therapy which is given to the kids, which is useful for certain diseases like strabismus or amblyopia, but it is not useful for reducing the eye power. I would be happy to take any more questions. So, since there are no more questions, I would like to thank all the viewers for giving their valuable time to listen to this Facebook Live session. Also, I will just reiterate the fact that stay safe, stay healthy. Please follow all the government guidelines. The government at the state level and the national level is working for you to keep you safe, and eat healthy, exercise daily, and keep the screen time limited. Thank you once again for Aditya Bidla uh, Capital Health Insurance to give me this opportunity to connect to so many of you. Thank you.